Hi everyone. As you'll all know by now, every one of us, staff and visitors, have to wear a mask now across our hospital sites. This is to help protect each other from further spread of coronavirus. And I just want to thank everyone who's been involved in making this happen. Our procurement teams for ensuring that we've got enough masks, our logistics teams for delivering them, our cleaners and housekeeping staff for safely disposing of them, and of course all the fantastic volunteers who've been at the front doors of our hospitals handing them out and explaining how to use them safely. I'm so pleased that the number of COVID patients within our hospitals continues to fall. Yesterday there were only 4 patients in Poole and none in Bournemouth at all. That's brilliant news. And wasn't it great, the fantastic breakthrough in the treatment for COVID? I'm delighted that both trusts have been involved in this research, and we now know that we've got a treatment for the very sick patients that really makes a difference. Dexamethasone is really going to make a difference. The results of this trial will definitely save lives going forward, which is great news for us, the UK, and indeed people across the whole world. And a great big thank you to all the patients and staff who took part in this trial, and we're so pleased to have been part of it in both of our trusts. Meanwhile, we've had quite a lot of media coverage last week. Lots of people are really interested in the work of our laboratories and all the testing that we're carrying out. The BBC came to the labs at Poole Hospital last week, and yesterday I did an interview with Radio Solent on the rollout of antibody testing. I'm really pleased to shine a spotlight on the work of all our laboratory staff. They've been hugely busy during the COVID period, firstly doing the essential tests that help our clinicians make decisions about the treatment of patients, and more recently in rolling out the antibody testing that helps to confirm who's actually had COVID. 13,500 of those antibody tests were done in the first 2 weeks. Both tests are really important, and for our labs, all these tests are having to be done at pace, in high volumes, and our staff have really had to make lots of changes in the way they work in order to do this. Our staff have been absolutely incredible, working under great pressure, and we're just so grateful to them. Thanks everyone. Of course, there's also been a lot of media and public interest in the work underway to get our hospitals back to some kind of normality. And again, the BBC visited Royal Bournemouth last week to have a look at our eye unit, and they talked to one of our surgeons, Mr. Rakmandani, about the work he's doing to deal with really serious operations and get back on top of those patients waiting. It's wonderful to be able to highlight the work of our teams, and we've got to explain how we manage everyone's expectations about things going forwards. I've also had the privilege of meeting with representatives of our Black, Asian and minority ethnic staff across the Trust. We've been talking about the things we're doing to keep them safe during COVID, but also listening to their thoughts around the Black Lives Matter protests, which have been obviously catching our attention. We need to do more together to step up our response to these inequalities, but I think we all want to reflect on that a bit more and think about what we need to do, what do we have to put in place so that we can get this right. Earlier this week I co-signed a statement along with our medical directors and our BAME staff representatives and members of our inclusion and diversity team, outlining the commitment of both trusts to ensuring that our health service is fairer and a more compassionate place to work and to receive care. This is not a quick fix, but we need to be really clear that within our organisations, Black lives really do matter. We value all our staff and we want that at the heart of our trusts. So we've arranged for our shadow interim board. They'll be meeting next month, and in July we're going to take time on one of our development sessions to think about these issues more deeply. In the meantime, I just want to say a big thank you to all the staff who have shared their experiences and provided feedback to us. Thank you so much for your honesty and taking the time to do this, because it's really helping us in making the right decisions going forward. In closing, I just want to reflect on the great news that we had last week, that we've been given permission to progress with our merger plans, and the date's been set. All things going well, we should be merging from the 1st of October 2020. This really is fantastic news. We know we can serve people better as the more resilient University Hospitals Dorset. Coming together will be of great benefits for patients and staff alike. By bringing services together, we can make our hospitals fantastic places for staff to work, and we can improve the quality of care provided for our patients. So finally, thanks again to everyone for all that you're doing at the present time. For a whole range of reasons, things really are looking up. Thanks.